PMS problems and symptoms and alternative therapies that are available is the subject here. I'm going to touch on not only premenstrual syndrome in women, but I'm going to touch on uterine fibroids, endometriosis, ovarian cysts, breast cancer, and for men we're going to talk about prostate enlargement and cancer, and we're going to touch on male pattern baldness. You can see here that all of these things have a hormonal relationship. The hormones, the steroid hormones, the reproductive hormones in the human body. And I'm going to offer several things that you can do and try or discuss with your doctor, and I always recommend discussing with your doctor first to help you. First off, I want to talk about chiropractic care. A lot of people don't necessarily flock to a chiropractor for hormone-related issues. However, a lot of women have figured out, particularly women that have been under chiropractic care and they're under wellness chiropractic care, let's say they come in once a month or twice a month, they time their chiropractic visits and their chiropractic adjustments to their menstrual cycle. They will come in a few days before their symptoms typically begin because they find that they get relief. Their symptoms are not as intense when they receive chiropractic adjustments. Pretty cool, keep that in mind. Let me talk to you about a situation that happened today in my office. A young woman comes in, 20 years old. Yesterday, she had terrible menstrual cramps, 10 over 10. Never had them that bad before. She came in today, there were less, at a 7. She also had an increase in back pain, very common, right? Very common. So this is the connection between menstrual problems, back pain, or if you will now going the other way, back problems, back issues, and menstrual trouble. Okay, so there's a connection there. So I asked her, and menstrual PMS symptoms, cramps, pain, 7 over 10, 10 over 10 yesterday. How's your low back? Low back is cranked up. It was doing fine. It's now like a 5. Fine. So I worked on her entire spine, gave her an adjustment. Her neck was bothering her a little bit more, middle back a little bit more, about 4 over 10. After we were done, after the chiropractic adjustment just took us a few minutes, neck, middle back, lower back were down to a 2. And I said, how are your cramps right now? She said, 0. Pretty cool. Didn't work on her abdomen at all. I just worked on her spine. Now that is one person with one adjustment. Obviously you can't make major conclusions from that. However, that taught her an important lesson, because when I spoke to her yesterday, I told her, I think you're probably going to start to realize the connection between some women seeing that their menstrual issues get better with chiropractic care. So that's number 1 on our list here, is chiropractic care. And a lot of women treat it that way. Now, when I was questioning, and this is going to lead into the other parts of our list here of things that you can try. When I was talking to this 20-year-old, I said, what do you think led up to this? She said, recently she traveled. I said, now and I'm aware of her, so I knew that she's a fairly clean eater as a 20-year-old, and she's a regular exerciser, but she had just taken a vacation. I said, on vacation, did you eat super clean? And were you exercising regularly? And did you get nice regular sleep? She said, no, I didn't eat good stuff. I said, do you think it might be related to you just got back and now things have flared up? She said, absolutely. There we go. So that leads into the other parts of our list. Number 2, in my 30 years of clinical practice now, I have found that when women eliminate dairy products, just one thing to try nutritionally, when they eliminate dairy products, they find that their menstrual symptoms get a lot better. Now, if you do this, I recommend that you do it for 90 days. There is no downside from removing dairy products. You're not missing any nutrition if you remove all dairy products. You're not missing any nutrition. There's nothing that you can't get from other sources. Great. So doing that, a lot of women have noticed improvements in all the list of things, premenstrual issues, ovarian cysts, uterine fibroids, endometriosis, and so forth. Worth giving it a try, and I've done many shows on that. You can go look on my YouTube page if you want to. So that's number 2. Now, number 3 is clean eating. You might need a nutrition overhaul depending on where you are right now with your nutrition. Okay? Before I talk about the other things, I want to point you to an article that's going to address nutrition overhaul by Dr. John McDougall. Go to his website, drmcdougall.com. In his search box, right from the home page, put in PMS, if I remember correctly, the first hit, the first link is going to be an excellent article on hormone-dependent diseases, male and female. He did a fantastic job on this. So again, he's going to talk about abnormal uterine bleeding, early menarche or early first period, fibrocystic breast disease, fibroids and tumors of the uterus, late menopause or late periods, ovarian cysts and PMS syndrome. And then he's going to talk about male pattern baldness and prostate enlargement and prostate cancer. His article says, women are supposed to be healthy and their female organs or functions are not supposed to be a curse, a word that has been used for centuries, right? Blood levels of hormones, including estrogen, progesterones, and prolactin, are dependent on your diet. A diet high in animal foods increases the level of these hormones, including estrogens. These hormones are made in the ovaries and adrenals. They're secreted into the bloodstream and then passed into the liver and intestines for elimination. In the liver, they're combined in a way to make them non-absorbable again, and then they're passed out of the body. A diet high in animal products, proteins, and fats will cleave off that enzyme that attaches to the estrogen. It now can be reabsorbed. So the estrogen that was supposed to be eliminated is now reabsorbed. The blood level goes up, and then you get all of the fallout from having an ongoing increased level of estrogen in your body, which wreaks havoc on women's reproductive organs in particular. Fibers present in vegetable foods help block the absorption of free estrogen, the stuff that's supposed to be eliminated, found in the bowel. Vegetarian women, compared to heavy meat eaters, excrete 2 to 3 times more estrogen through their bowels. 2 to 3 times more if you have a high vegetable diet. Obesity causes a body to produce more estrogens. Fat tissues, particularly abdominal fat, in men and women produce more estrogens. A lot of doctors have figured out when women lose weight, lots of these things clear up because another estrogen-producing center has been reduced or eliminated. Then he gets into the different sections. He talks about abnormal uterine bleeding. Bleeding and pain during menses is the quantity of endometrial tissue that's produced each month. If you produce more of it has to be cleaved off, causing all kinds of problems, bleeding, cramps, and pain. Early menarche, we have found that a high animal food, processed food diet leads to an earlier age onset of the first period, and that has been equated to more uterus and breast cancer later on in life because there's more time between the first period and the last in a woman's life that the estrogen-sensitive tissues are being bombarded by estrogen, if you will, okay? So a diet that's more clean, not a United States diet, but a more clean diet that's higher in vegetables, lower in animal foods, lower in processed foods, lower in crappy carbohydrates, you have a later age of first period, and then the positive consequences of that. Fibrocystic breast disease. For many women, breasts become tender just before the onset of menstrual periods. When estrogen hormones are the highest, in 10% of the women, the pain can be very severe. Overstimulation of the breast by higher estrogens causes the breast to swell and become tender. And after repeated bouts, the breast develops scar tissue. Milk ducts become plugged, forming cysts. And then that causes the pain. And then, unfortunately, there's a higher rate of breast cancer. Once again, a diet higher in the plant foods that are going to eliminate or reduce the overall level of estrogens in a woman's body long term is going to reduce the production of fibrocystic breast disease. Fibroids of the uterus, same thing. Overstimulation of the muscle cells that make up the body of the uterus by estrogens results in overproliferation of these cells, leading to cysts. Again, to prevent that from occurring, or to maybe help reverse that, you move to more of a plant-based diet, limiting your animal proteins and animal fats, and very much reducing or eliminating your processed foods. The other thing that happens too is when we're eating too much sugar and processed foods, we get insulin spikes every meal, every day. And every time you get more of an insulin response in your body, you're cranking up the inflammatory system in your body, which results in, again, in these reproductive steroid hormones being overproduced. Late menopause, like early onset, Late menopause in heavier meat eaters is oftentimes 4 years later. Again, those reproductive tissues are under more bombardment. Ovarian cysts. Researchers have discovered a simple alternative to fertility drugs and surgery for treating polycystic ovarian disease in overweight women just by losing weight. How do you do that? Clean diet, lots of vegetables, reducing the animal fats and proteins, reducing reducing processed foods and so forth. And then, of course, PMS follows the same line. Treatment, as Dr. McDougall says, for women, there's a better way to deal with hormone imbalances than to give hormone pills and remove the ovaries. The kind of foods, again, we eat in the United States need to be flip-flopped back to real foods, clean diets. Here's the next on our list. Dr. McDougall touches on it. This is extremely well established. Exercise. Daily exercise to your tolerance. Try to make it daily. I'd much rather have somebody walk a mile per day than walk 7 miles on Sunday. You try to do something every day, check with your doctor and do that. We know that reducing stress can help everything. Every time you crank down the cortisol and you crank up the serotonin that makes you feel great and fulfilled and satisfied, you reduce these hormonal systems that are convert to more estrogen. So reducing stress with all of the wonderful strategies we've talked about in this program, and there's other people that have wonderful ways of doing that. So learn that. Remember, regular sleep, more water is going to help your situations as well. And don't forget men. We know that benign prostatic hypertrophy and prostate cancer is once again related to the United States diet, which is higher in animal proteins, higher animal fat, low in plant materials, and high in sugar and processed foods and flour and so forth. When men do that, their prostate responds to now estrogens that are being produced, and that causes the overgrowth of the prostate and all of the situation there, and even male pattern baldness. Review of a Japanese book appeared in the Journal of Dermatology and Surgery. The title of the book is Can Hair Grow Again? And the review of this book is loss of hair as a result of increased activity of the sebaceous glands in the scalp caused by overstimulation by male hormones, testosterones, from, again, a high animal protein diet and fat diet. And this article and book followed Japanese men. After World War II, they started adopting more of a Western diet, higher in animal proteins and fats. Japanese men used to have full heads of hair, and now they're getting balding like we do in the United States. These are some really effective ways that you need to be serious at taking a look at to straighten out your hormonal systems and avoid these chronic diseases. I'm Dr. Scott Fuller.